Thanks for staying tuned. We continue the stories and incidents on Spotlight Africa this afternoon. Rwanda is a nation of over 13 million people with a limited pool of medical professionals with an estimate of about 1,500 doctors available to provide medical care. And it has been hit with 26 active cases of Marburg virus, with 12 fatalities reported as of September 29, 2024. Of course, this is looking to heavily strain the already overwhelmed healthcare system in Rwanda, with over 80% of those affected by the virus being healthcare workers. There are questions as to how much of this is going to spread to the rest of Africa and how susceptible other African nations are. We're being joined by Dr. Dan Abia, who is a medical expert from Uyo this morning to have this particular conversation. Good afternoon, Dr. Abia. Good to have you on the show.
Good afternoon.
All right, then, let's delve right into the conversation. I think a fair place to start is to ask, has Nigeria registered the presence of Marburg virus? Should we be concerned?
Colin, I didn't get the question. As Nigeria?
I'm asking if Nigeria has registered, any case of the Marburg virus, and should we be concerned?
Yes, we should be concerned. If I can get the question right, should we be concerned since Nigeria has recorded a case?
Have we, on the one hand, the question is, have we recorded a case? And if at all, if it's yes or no, should we be concerned with the rise of the virus on the continent?
We've not recorded a case to the best of my knowledge of my last research, but currently there's an outbreak in Rwanda.
All right then. So we are looking at several.
And we should be concerned because of how highly infectious this disease is, and because of how high the fatality rate of this virus is. So it should be a big concern for the public. So as far as we have it at our doorstep in Africa here, we should put things in place to, prepare in case the outbreak comes this way.
Okay, so in talking about Marburg virus, what exactly is Marburg virus? What's the virus about? How did it, originate, and how does it actually affect humans?
Okay, Marburg virus is a virus that belongs to a family of what they call viloviruses, similar family with Ebola. In fact, Marburg virus has similar signs and symptoms like Ebola. If you can remember the Ebola virus we had.
Absolutely.
Good. Hello?
Yes, I'm with you loud and clear.
Yes. So now Marburg virus, basically, it came from, it was discovered, how is somebody infected? From bats. Bats, it looks like a reservoir. Bats are reservoirs of this virus. Rosetus bats, to be specific. They are reservoirs of this virus. This virus was first isolated in these bats, and its spread can be traced to these bats. And these bats actually are concentrated in bat-infested areas, caves, mines, and all of that. So, moving forward, the virus itself, the bat carries this Marburg virus, and it can be spread via direct contact. You understand me?
Absolutely.
Through broken skin, mucous membrane, you understand, bodily fluids of infected persons. And the virus itself was first discovered not even in Africa. It was first discovered in Germany in 1967. And that's how it earned its name, in a city called Marburg. That is the first place it was discovered. And I guess the virus was now named after that city. It was first discovered in Germany, and from Germany, Marburg City, Frankfurt, those were the areas of its early discovery in 1967. But as the years went by, the spread got to other countries. even in the Soviet Union, then before in DR Congo, Democratic Republic of Congo. Now finally, it's already in Rwanda this year.
Okay.
So the virus can be traced back to as early as 1967.
So what we currently know is that Rwanda is the epicenter of the Marburg virus as we speak. As you know, they already have 29 active cases, but over the years we have registered the virus in other parts of the continent. With the statistics already given with regards to the medical professionals in the country, and which they are the ones worst hit by the virus, how do you think that they're coping in the face of these, disease, as it were?
Oh, I didn't get that last part clearly.
How do you think that the healthcare workers in Rwanda are currently facing? They are the highest percentage of infected persons with the virus.
Yes, they of course the people at risk are at highest risk are the healthcare providers in Rwanda. So what's your question?
So I am asking, in the face of the dwindling numbers for healthcare workers, how do you think that they're combating with all of that and still providing Medicare, in the nation?
Oh, okay. In cases like this, they have to activate what they call a control mechanism, meaning that patients that have come in contact, patients that are infected, and people that have come in contact, they have to do what they call contact tracing. They have to put in place. Patients have to be isolated. There are so many things that has to be done. Awareness has to be created to the people on what to do once those signs and symptoms, or someone around you is presenting with signs and symptoms that are suggestive of the Marburg virus. Enough awareness must be done. Infected patients have to be isolated, or what we call quarantined, basically, and health workers have to activate preventive protocols on working with patients that are infected already.
So
things like face mask, the attire to prevent getting in contact with bodily fluid have to be put in place. There are so many things that have to be put in place, and I think the Rwandan health system is doing that currently to battle the outbreak.
So we can tell that there is no vaccine available for the Marburg virus. Only, the vaccines available are only on clinical trials. So with this, how then are we handling the spread of the virus, as it were? If there are no vaccines, what treatments are available, to address the issue?
Come again?
We're talking about the fact that there are currently no vaccines available for Marburg virus. So what treatments are available, to combat the spread of the virus?
Okay, you mean what treatment is available?
Yes, treatments, and the fact that there are no vaccines available yet.
Okay, basically, patients that are already infected can be managed for secondary diseases or secondary ailments, like keeping the patient hydrated, monitoring the person's oxygen level, and treating with antibiotics, antifungal, and all of that. Secondary treatment, but a primary vaccine for the virus isn't available at this point. But of course, the symptoms can be treated just to keep the patient alive. So, although the prognosis is not very good because of how fatal the virus is.
So talking about the prognosis of the disease, how life-threatening is the Marburg virus? Maybe even as compared to the Mpox, how concerned should we be?
The case fatality rates, is that what you mean? Based on the prognosis, it's about 61.9%.
So an average of how many persons may die as a result of contracting the virus?
Well, on an average, if 10 people, for example, have the virus, it's very 6 out of 10
may probably die.
Yes, 6 is high. Is that?
So you're saying 6 out of 10 infected persons may probably die as a result of the virus?
Yes, Exactly, yeah, as a result of the viral, yes.
All right then. So one of the questions I'm going to come back to is Nigeria is not, even highlighted as one of the countries that may, get the Marburg virus because of our topography and where we are situated. Countries that are more susceptible are those that have the BATS, topography. So looking at all of this, how does Nigeria prepare itself in case of tourism contracted Marburg virus in that sense?
Well, we have in Nigeria, at least our health system has what they call the epidemiology departments, which have the technical know-how and the skills to handle outbreaks. We have disease center Center for Disease Control. Sorry, so they are the ones that are infested with the skills on how to handle these outbreaks. But although Nigeria hasn't recorded any outbreak yet, but I believe, of course, things are put in place to still battle it if it comes this way, because it's just very similar to Ebola. Mm-hmm. It's very similar to Ebola. In fact, you can't differentiate it by the clinical symptoms with Ebola. You can't. The only time you can actually differentiate Marburg virus and Ebola is after doing under the microscope. That's when you can differentiate it, and during taking of history of the patient. So in that of Marburg virus, there's always a history of someone either working in the mine or someone that has gotten in contact with bats or something like that.
Fruit bats, yeah.
The signs and symptoms with Ebola are similar.
Okay. So just to wrap this up, for those of our viewers that are watching us from the African countries that can contact this particular virus, I'd like for you to reiterate how we can actually handle ourselves if one was to contact it or we see these symptoms around us. What are the safety measures that everyone needs to be more aware of in the face of the Marburg virus as we wrap up this afternoon?
Okay, come again. You said I didn't get you this thing.
I'm asking you to just rerun the awareness that everybody needs in the face of the Marburg virus. If I see someone who has contacted the disease, or if I begin to feel some symptoms, what should I do?
Okay. If I can hear your question right, you're asking about prevention.
Yes, how everybody should be, readily armed in the face of the virus.
Okay. Basically, washing of hands, very important. Maintain a regular hygiene. Disinfecting surfaces. Avoiding contact with people that are already infected. Reporting. In fact, anytime you see symptoms presenting like high fever, headaches, severe abdominal pains, it's better you reach out to your nearest health facility to, report to a doctor close by.
All right,
for verification. But at home, it's good to keep a healthy hygiene, always washing your hands, disinfecting surfaces, avoiding, contact with anybody that is actually ill, and isolating someone that you notice is having these signs and symptoms. You isolate the person first before, then you now inform health authorities.
All right then. Thank you so much, Dr. Dana Bia, for coming on Spotlight Africa and sharing your wealth of knowledge with regards to the Marburg virus. Thank you for your time. Well, that's the much we can actually take on Spotlight Africa this afternoon, just bringing you awareness on the Marburg virus and how it does affect us as a continent. Thank you so much for being a part of today's narrative. I am Uyai Emem. Have a pleasant afternoon.